Good morning and welcome to the January 14th meeting of the Joint Standing Committee on Health and Human Services. I'm Representative Meyer and I'll be presiding over 4 public hearings here today. The purpose of the public hearing is to invite testimony from members of the public regarding proposed legislation before this committee. Our agenda here today, starting with the first 2 bills in this order, would be LD 2001, followed by LD 2021. Then this afternoon at 1 o'clock, we'll begin with LD 1989, followed by LD 2051. The committee will hear testimony from people present and on Zoom who wish to speak for, against, or neither for nor against the bills to be heard here today. With leave of the chair, committee members may ask clarifying questions of the person testifying today. The public hearing is just that. It's for the public. The committee will have time for deliberation and debate at the work session that will be scheduled on these bills within the next few weeks. Whether you testify or not, you can submit written testimony to the committee, which we read. Please be mindful that testimony is public and available to all once presented. This hearing is live streamed and they're on the legislative website as well as YouTube, and there are recordings at both of those sites of the meeting. Please silence all electronic devices, including those of us behind the horseshoe. If you're having technical difficulties, please call our clerk, Sophie, at 287-1317. Some of our committee members serve on other committees, so you'll see us coming and going throughout the day. You may also see us back here eating and drinking at the horseshoe. The public is not permitted to eat in the committee room. However, feel free to drink water. I'll ask the committee to introduce themselves. We'll start actually down on this end with Representative Lemelin.
Good morning. I'm Michael Lemelin. I represent House District 53, Chelsea, Randolph, Pittston, and Dresden.
Good morning. I'm Representative Dan Shigori, and I represent House District 55, the communities of Holwell, Manchester, and West Gardner.
Good morning. My name is Julie McCabe. I represent District 93, part of Lewiston.
Good morning. I'm Representative Annie Graham. I serve the people of North Yarmouth and the majority of Gray, House District 105. And a beautiful day today.
Good morning. It is a beautiful day. I'm Lucian Daigle. I represent House District 1, the extreme northern part of Maine, and it's still the nicest.
Hello, good morning. My name is Flavia De Brito. I represent House District 64, which is part of Waterville and part of Winslow.
Hello, my name is Sam Zager, honored to represent District 116, part of Portland.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, along with 16 communities in eastern Hancock County, beautiful down East Maine.
And I am Representative Michelle Meyer, serving Southern Maine's District 150, which is all of Elliott, where I live, and parts of Kittery and South Berwick. We are also joined today by our nonpartisan staff, Anna Broom, to my right in the back from the Office of Policy and Legal Analysis, and our very capable new clerk, Sophie Doobie. We run a 3-minute clock here on testimony, with the exception of bill sponsors and co-sponsors, legislators, and out of respect for the department, we do not run a clock on testimony. You'll see the clock in the front of the horseshoe. As you're approaching the 3-minute point, please wrap your testimony up. For those who are on Zoom intending to testify, you will not be able to see the clock, but I will give you a gentle nudge as 3 minutes is approaching. If you have prepared testimony, please provide 20 copies to our clerk. You can leave those copies at the end of the horseshoe next to Representative Lemelin. Please sign in at the podium, and we thank you for joining us today. I will open the public hearing on LD 2001, and I will be presenting that as its bill. The bill's sponsor is not here today, and you. fellow members of the Joint Standing Committee on Health and Human Services. As you know, I am Representative Michelle Meyer, and I am presenting testimony on LD 2001, an act to clarify the laws governing facilities for children and adults under the Health and Human Services laws. Senator Ingwerson proudly sponsored this bill on behalf of the Office of Child and Family Services, an office within the Department of Health and Human Services that we are all familiar with. In discussion with the department, we understand that they have identified a few areas of statute relating to the laws governing the licensing of facilities for children that need to be changed or updated. This bill will go through 5 specific changes, which I will allow the department to detail following my testimony. In short, this legislation would address a confidentiality issue, correct a statutory reference regarding the consolidations of functions, clarify licensing requirements, remove statutory reference to collaboration between DHHS and the Department of Education that no longer occurs, and eliminate a burdensome requirement that applied only to childcare providers licensed as nursery school programs. I hope that you will join me in supporting this effort to provide statutory clarity for OCFS and for those licensing requirements that are impacted. I ask that you hold any questions that you may have for the department.
Thank you, Representative Meyer. And as she asked that you hold your questions, so I'm not even going to. So I guess at this point, then I would ask the department to step forward and.
Thank you.
Good morning, Representative Meyer and members of the Joint Standing Committee on Health and Human Services. My name is Bobby Johnson, and I serve as the Director of the Office of Child and Family Services in the Maine Department of Health and Human Services. And I just wanted to start by expressing my condolences for Representative Javner. I'm here today to testify in support of LD 2001, an act to clarify the laws governing facilities for children and adults under the Health and Human Services laws. This bill is intended to update statutes related to the licensing of facilities for children. This bill was brought forward by the department to address inconsistencies related to licensing that are having a negative impact on the department's Children's Licensing and Investigation Services team, licensed providers, or both. It includes 5 components. Section 1 of the bill addresses an issue identified for the Office of Child and Family Services by the Office of the Attorney General, that the language of 22 MRSA, Section 7703, makes the records of an investigation of neglect or abuse by the Children's Licensing and Investigation team confidential, but that confidentiality does not extend beyond the investigation if a finding made by the team is administratively appealed by the provider. OCFS does not believe that it was the intent for confidentiality to be limited to the investigation only and not extend to activities during the administrative review. Section 2 of the bill corrects an oversight in the work done by OCFS and the legislature in 2023 when an act regarding investigations of out-of-home child abuse and neglect was enacted and relocated the statutes for investigation of out-of-home child abuse and neglect to the Child and Family Services and Child Protection Act. Thus, this change provides the confidentiality of both provider and client information throughout any proceedings that might follow. Section 3 of the bill corrects a recently identified issue with changes enacted in 2019 and an act to increase the availability of foster homes. That bill sought to eliminate the requirement that resource, also known as foster homes, be subject to the state fire marshal inspection. It was OCFS's intent at that time that the exception to this requirement would extend to all resource homes, but it has become clear that there is more specificity needed to the language of the statute in order to appropriately effectuate that intent. Section 4 of the bill removes an outdated reference to a statutory requirement for interagency licensing that no longer occurs between DHHS and the Department of Education. Each entity conducts their own independent licensing and approval process for any providers that cross over into the authority of both departments, ensuring equity for all providers and safety for children regardless of the settings. And Section 5 of the bill removes another outdated reference, this time to a licensing requirement specific only to childcare providers licensed as nursery schools. It requires they provide a declaration from a licensed medical provider at least every 2 years that certifies that the administrator or another staff member of the nursery school is free from communicable disease. This requirement is not present in the licensing statute for any other type of licensed childcare provider, which results in an undue burden to just one type of licensed childcare provider. OCFS is asking for your support in addressing these issues to best streamline the operations for our talented and dedicated Children's Licensing and Investigation Services team, as well as for child welfare as OCFS seeks the continued removal of barriers to licensing as a resource home, just as was intended by the 2019 bill. Thank you for your time and attention, and I would be happy to answer any questions you may have and to make myself available for questions at the work session.
Thank you, Bobby. What questions do you have for Bobby regarding this? I'm not seeing any. Thank you very much.
Great, thank you.
That was easy, right?
It was.
So at this time, then I would ask if there is anybody in the room with testimony in favor of LD 2001. I'm not seeing any. Is there anyone online that was, okay? Is there anyone in the room that's in opposition of LD 2001? Would like to come forward? Not seeing anyone, no one online. Anyone in the room for neither for nor against or to provide additional information? Again, I'm not seeing anyone. So I guess at this point, is there anything else that the committee would like our analysts to give us for the work session? Not seeing any of that either. So I guess I will close the public hearing on LD 2001. And okay, so then I am going to open up the public hearing for LD 2021, a bill to add an online option for reporting of suspected abuse, neglect, and exploitation of adults. It is being presented by our chair, Representative Meyer. At this point in time.
Good morning, esteemed members of the Joint Standing Committee on Health and Human Services. I am Representative Michelle Meyer, and I am here to present LD 2021, an act to add an online option for reporting of suspected abuse, neglect, and exploitation of adults on behalf of the Department of Health and Human Services. This is a bill brought forth by the Office of Aging and Disability Services and would ensure compliance with federal regulations that became law in June 2024. Currently, Maine law states, quote, reports regarding abuse, neglect, or exploitation must be made immediately by telephone to the department and must be followed by a written report within 48 hours if requested by the department, close quote. The new APS federal law requires that states allow for at least 2 methods of reporting, one of which must be online. This simple change will bring the state of Maine into compliance with federal law and provide an additional avenue for reports to be made. I hope we can all agree that those are 2 very good reasons to support this bill. The new director of OADS, Betsy Hopkins, will provide additional information regarding existing online capabilities following my testimony, and I ask you save your questions for Director Hopkins, and thank you for your time and attention.
Thank you, Representative Meyer. And again, we'll delay our questions, and I would ask the department to come forward. There is some testimony that's suggesting additional. All right,
Good morning. Good morning, everyone. Representative Meyer, thank you for sponsoring this bill, and good morning to all of you at the Joint Standing Committee on Health and Human Services. As Representative Meyer mentioned, I'm Betsy Hopkins, and I'm the new-ish ODES Director here and at DHHS, and I'm here to testify in support of LD 2021, an act to add an online option for reporting of suspected abuse, neglect, and exploitation of adults. Under current law, mandated reporters are required to report suspected abuse, neglect, or exploitation of adults to the department by telephone. LD 2021 would add an online reporting option for mandated reporters, providing an additional method for submitting those reports. This change would bring Maine statute into alignment with federal regulations finalized in June 2024, which requires states to offer at least 2 methods for reporting, one of which must be online. The Office of Aging and Disability Services Adult Protective Services Intake Unit already allows members of the public who are not mandated reporters to submit reports of abuse, neglect, or exploitation through an online portal. LD 2021 would clarify and update our statutory framework to allow mandated reporters to also use this existing APS intake system. Maine has until May of 2028 to comply with the APS federal law, and LD 2021 addresses one component of that federal law and provides mandated reporters with an additional accessible option for reporting those concerns. Thank you for your time today. I'm happy to answer any questions or be available for the work session.
Thank you very much, Mr. Puget. Any questions for the director? Go ahead, Representative Daigle.
So you'll have the online avenue available for non-mandated people. Nothing really needs to be done to allow mandated people already to use that same avenue?
Right. We would just make sure we do some education and training about the use of the portal. But other than that, it's all ready to go.
Okay.
Yeah.
Any confidentiality issues at all that would?
It's
a
already
problem?
set up for that. It's already
Okay.
set to address that.
All right.
Yeah.
Thank you.
Representative Zager.
Thank you, Senator Moore. Good to see you, Director
Yes.
Hopkins. Technical question here. What would be the difference between a report, like a written report via the online portal, and the written report that would then need to be followed up? Is it like a matter of detail, or is it just to, what's the difference between the two?
So right now, people call the 800 line and can talk to an intake. So we have an intake unit, and they talk to somebody and they make a report to somebody through the phone. There's an option, though, online for them to fill out a form, basically, that makes the same report in writing instead of to somebody talking to somebody. Is that what you mean?
No, but thank you for that. It says, and must be followed by a written report within 48 hours if requested by the department. But if somebody submitted something online, is that not a written report? And if not, then what's the difference between that?
Oh, so
in
the
writing
report, so the information is taken and then a follow-up, a report about what happens with that, report. That's
Okay,
what that is.
To
Yeah.
answer questions, get more
Yes,
detail. Okay,
yes,
thank you.
exactly. Yep.
Other questions? Yes, Representative.
So the 48 hours, does that mean that a human will actually get to review the intake within 48 hours?
Yes,
So that's the maximum.
yes. They're
turnaround
all the
time.
reports are triaged and reviewed and then, in this case, sent out to the region. The APS is regionally based APS workers, so it would be sent into the region to then do a follow-up, whatever's needed for follow-up, depending on the nature of the report.
Okay, thank you.
Yeah.
We did have some testimony that was received online. I don't know if you've had an opportunity to read it or not. Came in from Colleen Brown, and there were just a couple of questions. One of them was how quickly the online reports were
Mhm.
reviewed, so that was 48 hours. Are urgent cases identified or prioritized in any way?
They are prioritized, and that's part of the piece of work that's done right from the intake unit.
Okay, the triage itself at
Yes,
the very
yep.
beginning, okay. Now, do the reporters actually receive confirmation and guidance once they've turned that in, or?
You mean the person who reported?
Correct.
That's not generally doesn't currently happen at this time. Oh, this is the
That was the
testimony. Yeah, the
online
question.
response,
Okay.
yeah, that we got.
Uh,
So they are
Right
not
now, the
receiving-
person is not informed about the results of their report.
Okay. And I know they're not, but they do receive confirmation though that it's been processed,
Yes.
right? I think that's probably the
Okay.
primary. I know we've had that conversation about, mandated reporters and
Yeah,
knowing what happened.
yeah.
It's just confirmation that it's been received, but we
Mhm.
don't always know that.
Right.
And then, of course, there was some concern about the increased volume, with the capacity, if that's going to cause a problem with adding that to the online.
I guess we'll have to watch that. We do report on a quarterly basis on the volume and the information and the numbers and the types of reports that come in. So we'll definitely be keeping
Be
track
able to
of
keep
that.
track of that. So
Yeah.
we may have to come back at a later time and ask
Mm.
for some additional
Mm.
funding to go with that. Okay, and then, so I guess the other question she was asking is how will we know if it's working? But, the report back, the quarterly report backs, hopefully.
That's
we'll be
right.
able
And
to-
we also have we provide to the legislature actually every other year, a plan and then a report. And we include all of the APS data in that
Okay.
report on ODES.
Okay, great. Thank you. I
Yeah.
think that addressed the questions that were here, so that's good.
Sure.
Any other questions? Yes, Representative Zager.
Thank you, Senator. Question of opportunity here. Yesterday, a sheriff asked me about scams for, elders being targeted for scams.
Mm.
Is that something that would be reportable through this? Is that considered elder abuse if somebody is taking advantage of,
Mm.
say, a mild cognitive impairment? It seems like, and he was concerned because of things that have affected their operations. And so it's relevant to this bill because if the sheriff's departments can report those sort of things through an online portal, that might make it easier from their end as well.
So that would be considered exploitation. So financial frauds or scams, and that is included under this, under APS.
Okay, so I
Yeah.
can tell him that would be something that his deputies
Yes.
could.
Yeah.
Okay, thank you.
Any other questions? I think that answered. Thank
All right,
you.
thank
you so
you.
much for that. So at this time, I guess I will open up the public hearing for public comment in favor of LD 2021. Ready.
Good morning, Representative Meyer and members of the committee. My name is Laura Harper. I'm a senior associate at Mooseridge Associates. I live in Hollowell. I'm here today on behalf of my client, the Long-Term Care Ombudsman Program. The Ombudsman Program provides statewide advocacy services for older and disabled adult residents of nursing homes, residential care, and assisted living, and for recipients of home care services and participants in adult day services. And we are very pleased to support this bill before you today. Current law, as you know, requires that reports to DHHS regarding abuse, neglect, or exploitation of adults must be made by telephone. And this bill adds the option of reporting by an online portal to align with state and federal regulations. As advocates, we work statewide to educate staff in long-term care facilities regarding their responsibility to report abuse, neglect, and exploitation. We believe that creating an additional reporting mechanism would help remove barriers and increase reporting rates. Many workers have shared that contacting APS by phone feels intimidating. This proposed amendment may offer a more accessible reporting option, thereby strengthening protections for vulnerable residents. And this may also increase the rate of referrals. The Maine Elder Justice Roadmap, established by the executive order of the governor back in 2021, highlights that elder abuse is often unreported. And the report states that there are over 40,000 Mainers over the age of 60 who experienced some form of abuse back in 2020, though research shows that most abuse cases are never reported to authorities. So we believe this legislation establishes an important safeguard for vulnerable residents and may improve reporting outcomes. And I thank you for your consideration. I'm happy to try to answer any questions, but if I don't know the answers, I'll get back to you for the work session.
Thank you. I really appreciate that, Laura. Questions for Laura? Not seeing any.
Okay,
Thank
thank
you.
you.
Thanks. Anyone else in the room with testimony in favor of LD 2021?
Good morning, Senator Moore, Representative Meyer, members of the Joint Standing Committee on Health and Human Services. My name is Marge Kilkelly, and I'm here today on behalf of Legal Services for Maine Elders. LSE provides free legal help for Mainers age 60 and older when their basic needs are at stake. LSE serves older Mainers across the state. Our clients are generally low income, some with medically complex conditions. Most are deeply rooted, contributing members of their communities. We appreciate and support the efforts of Representative Meyer and the Department of Human Services to bring before you LD 2021. LSE is not a mandated reporter, but we work with many survivors of all types of elder abuse and their families. Abuse, neglect, and exploitation of adults, especially those that we serve, is a critical issue that means the difference between a person living out their life comfortably in their home, in their community or residential facility, or living in fear or desperation. In recent months, the rate of our elder abuse caseload has increased to the point where it matches the number of housing-related cases, and that's usually our highest category. Modernizing the process for mandated reporters to report suspected cases by creating an online portal not only conforms Maine to federal law, but also makes the process of reporting easier. Online reporting can also improve confidentiality by not requiring the reporter to verbally provide the details of a case over the phone. Thank you for your consideration of our comments on LD 2021, and we urge its adoption. Thank you.
Go. Thank you very much, Marge. Any questions for Marge? I'm
Thank
not
you so
seeing
much.
any. Thank you. Anyone else in the room to testify in favor of LD 2021? Is there anyone online? No? Anyone in the room to testify in opposition of LD 2021? Not seeing any. No one online. Anyone in favor, for or nor against, or to offer additional information on LD 2021? And again, no one online. I don't see any more. Then I will close this public hearing on LD 2021. And I'm proposing that we maybe take a 5-minute caucus break and come back and we'll finish up our morning session here. Thank you.
What's that? Is she actually on?
Yes, she is.
Is she going to turn on?
She is going to go on video.
Okay,
Yeah, and I told her that. So she thought we could see her name and I said, not until she shows her video. So, yeah, and that she's going to. Yeah, she's going to do that.
okay, so I'm just going to take this back and
Okay,
go
go
into.
But yeah, go ahead. You want to do that? Yeah,
Eh,
because I closed the public hearing.
Okay,
It's perfect.
actually,
Okay, so is everybody back? We'll reconvene this committee meeting. At this point in time, I would make a motion for us to go into work session to address LD 2021. Thank you. Thank you, Representative Zager. So all those in favor? Any opposed? We're good. Okay, so now I'll open the work session for LD 2021. Representative Griffin, we're not seeing you. I don't know if you.
Okay, then I don't know what to do. Oh,
We hear you. We just, there,
okay.
whoops.
Oh. How about now?
We don't see your camera.
Oh, maybe. Okay,
Can you
I'll
do the,
just-
well, can you, you should have the icon down at the bottom where you can unmute the camera.
yeah, and I did that. Is it, maybe it has to do with my computer?
it's unmuted on Zoom.
It is unmuted on Zoom. That's why we're seeing just your name, but we're not seeing your camera.
Picture.
Yeah.
So it doesn't look like my camera's on, so maybe I need to just work on that.
She might try her phone.
Okay. I don't
That's
know.
all right.
Senator Moore, if I may, sometimes, Representative Griffin, it's at the very top, your camera may be closed by
Oh, that's
mistake. There's
right,
a
for
little
privacy.
shutter there that, I know I've by
That's
mistake
right.
had
She's
it on.
that
so
before.
Might want to check that.
There, yay.
Thank you.
Introduce yourself.
So first of all, before we go, there we go, perfect. If you wouldn't mind, Representative Griffin, introducing yourself, or welcome back.
Yeah, it's good to
Yeah.
see everybody. Hi, my name is Abigail Giffen. I represent House District 34, which is Glenburn, Levant, and Kudeske.
Great. Well, we're glad you're able to join us today, Abby. This is great, Representative Griffin. So I guess at this point, I would entertain a motion to address LD 2021.
I think we
We
went into.
We're in work session.
Okay.
But what's the motion for the bill? That's what I'm asking for, is a motion on the bill. How do you want to, what would you like to do with it?
Go ahead, Sam.
Go ahead, Representative Zager.
Thank you, Madam Chair. I move up to pass on LD 2021.
All right. Any other discussions, questions, concerns? All those in favor?
I can write.
Looks like it's unanimous. Thank you very much. Great. Thank you, everyone.
Online.
Yeah, she raised her hand. Yeah, so you could see it over here. Okay, great. Thank you. All right, so I guess at this point, we have finished our morning business and we have two public hearings that are scheduled to begin at 1 o'clock this afternoon. So I guess we will go into recess until 1 p.m. this afternoon. Thank you, everyone. A long lunch. That's nice. There you go.
Good afternoon and welcome to the Joint Standing Committee on Health and Human Services. We are assembled behind the Horseshoe today, January 14th, for two public hearings. We will hear LD 1989 first, followed by LD 2051. We will take testimony from people present on Zoom and those who wish to speak for, against, or neither for nor against the bills being heard today. With leave of the chair, committee members may ask clarifying questions of the person testifying today. The public hearing is just that. It is for the public. The committee will have time for deliberation and debate at the work session that will be scheduled over the next few weeks. Whether you testify or not, you can submit written testimony to the committee. Please silence your electronic devices. There's drinking of water in the committee room, but you may see committee members eating and drinking behind the Horseshoe. Some committee members serve on different committees or are presenting bills in other committees, so you'll see us getting up and leaving and then coming back. I think I'll ask the committee to introduce themselves again today. Go ahead, Representative Graham.
Thank you, Madam Chair. Good afternoon. I'm Representative Annie Graham. I serve the people of Gray and, North Yarmouth and the majority of Gray. I apologize. Serving on two committees kind of gets my brain rattled. Thank you.
Good afternoon. I'm Representative Lucian Daigle, and I represent House District 1, the northernmost part of Maine, and I'll start the argument by saying it's the nicest part of Maine.
Oh, enough.
Hello, good afternoon. My name is Flavia De Brito. I serve House District 64, which is part of Waterville and part of Winslow. Well,
Hello, my name's Representative Sam Zager. I represent District 116, which is part of Portland.
Good afternoon. I'm Mary Ann Moore, and I represent Senate District 6, which is all of Washington County and 16 communities in eastern Hancock County. And what Representative Daigle was talking about, I always bring up Down East is beautiful. We really are blessed to live in a beautiful state, no matter where we are. Thank you.
Hi, I'm Michael Lemlin. I represent House District 53, Chelsea, Randolph, Pittston, and Dresden.
Hi, I'm Representative Dan Shigori. I represent House District 55, the communities of Holwell, Manchester, and West Gardner.
Good afternoon. My name is Julie McCabe. I represent District 93, part of Lewiston.
And I'm Michelle Meyer. I serve Southern Maine's District 150, which is all of Elliott, where I live, parts of Kittery and South Berwick, and I'm honored to serve as this committee's House Chair. Also on Zoom joining us today is Representative Griffin.
Good afternoon. My name is Abigail Griffin. I represent House District 34, which is Glenburn, Levant, and Kedeskeg.
And we have our nonpartisan staff here today. To my right is Sam Seneft from the Office of Policy and Legal Analysis, and our clerk, Sophie Dubé. We run a 3-minute clock here on testimony. You'll see the clock on the front of the Horseshoe. As you're approaching the 3-minute point, please wrap your testimony up. We do not run a 3-minute clock on the bill's sponsor, co-sponsors, or legislators, or the department. If you've got 20 copies of your testimony, you may leave them on the end of the Horseshoe near Representative Lemelin. And with that, I will open the public hearing on LD 1989. Welcome the bill's sponsor, our own Senator Moore.
Good afternoon, Representative Meyer and fellow members of the Joint Standing Committee on Health and Human Services. As you know, my name is Senator Mary Ann Moore, and I'm here to present LD 1989. It was a good year. An act to increase access to the Progressive Treatment Program Fund. I have sponsored this bill on behalf of the department and was happy to do so because it will help ensure providers and other entities can effectively access and utilize the Progressive Treatment Program Fund dollars. The department will follow my testimony and provide additional details about the program and the legislation as to this morning. But as a reminder, the PTP is a program for individuals with serious mental illness who pose a likelihood of serious harm to themselves and are unlikely to follow a treatment plan voluntarily. Although the program is court-ordered, individuals who participate have the benefit of a suitable individualized treatment plan supported by licensed and qualified community partners. Current law only allows for reimbursement of private entities to initiate such programs. This bill would allow mental health care providers to request reimbursement from the Department of Health and Human Services for both the initiation and renewal of the PTP, subject to available funds. It would also remove the maximum reimbursement amount, which is currently set at $800. These changes proposed by the Office of Behavioral Health are responsive to feedback they have received from several providers and other entities and will help improve the utilization of PTP in Maine. I will mention that I handed out another proposed amendment for your consideration related to the bill, and I know the department is aware of it, has supported it as well. I just want to point out the difference. What we're basically doing is adding law enforcement and the legal guardian's legal counsel along with the mental health care provider. So that expands the opportunity for the people who are right in the midst of it, know what's going on, and can ask for the funding that is going to be so needed. Another suggestion is that we do say in our bill that that we could do it subject to available funds. So the concern is that we may run out of money. And so the suggestion is that perhaps we put a cap on it saying up to $3,500 per initiation or renewal of it, just as a suggestion to help so that the funds can be spread across all the different folks that really need it the most. So I hope you will join me in supporting this legislation. Again, thank you. I do ask you hold your questions for the department because I don't think I can answer them.
Thank you, Senator. We'll honor your request and would ask the department to approach. Good job.
Okay. Representative Meyer and members of the Joint Standing Committee on Health and Human Services. My name is Deb Poulin, and I serve as the Clinical Director of the Office of Behavioral Health in the Maine Department of Health and Human Services. And I'm here today to testify in support of LD 1989, an act to increase access to the Progressive Treatment Program Fund. Some of this will feel like deja vu to you, but the Progressive Treatment Fund and/or PTP is a court-ordered outpatient program for individuals with serious mental illness who pose a likelihood of serious harm to themselves or others and are unlikely to follow a treatment plan voluntarily. Although court-ordered, individuals offered PTP plans have the benefit of a suitable individualized treatment plan supported by licensed and qualified community providers. Adherence to these plans protects individuals from interruptions in treatment, relapse, or deterioration of mental health, while also enabling them to live more safely in a community setting by ensuring consistent and structured mental health treatment. For a PTP plan to be initiated or renewed, an application must be submitted on behalf of the individual to the district court, where it is then reviewed and scheduled for hearing. As the applications are inherently a legal process, representation by counsel is most often required. The statute currently only provides for reimbursement of legal fees to private entities up to $800 and only for the initiation of PTP plans. The intent of this bill is to ensure that providers and other entities can effectively access and utilize the Progressive Treatment Fund. The Office of Behavioral Health has received feedback from several providers and other entities that the current statutory language lacks clarity regarding the renewal of PTPs, but also that the current funding limit of $800 imposes additional challenges for smaller providers in particular, who generally need to retain external counsel with hourly rates that often exceed the maximum reimbursement. The proposed amendments of the current statute exclusively serve to address the aforementioned confusion and provide greater flexibility in utilizing available fund resources for initiations and renewals of PTP plans. Additionally, we support allowing anyone who is eligible to file for a PTP to have access to the PTP funds, which is what you spoke of. By allowing the fund to be utilized for both initiations and renewals alike and adjusting the maximum reimbursement in statute to allow opportunities for individual funding pursuant to set criteria, this bill serves to address challenges for both mental health providers and individuals seeking to utilize or who may benefit from the PTP. When used effectively, it can prevent unnecessary hospitalizations and justice system involvement and ensure individuals with serious mental illness can receive the treatment necessary to foster their independence and longer-term success in less restrictive community settings. These minor changes to the statute seek to address seek to address inconsistent access and application of the PTP and reduce confusion by providers submitting applications on behalf of eligible individuals. It also serves to improve renewal rates and, as appropriate, by allowing providers to seek reimbursement beyond the initiation as provided in current statute. Accessing funds involves submissions of an invoice reflecting requested reimbursement amount, the attorney bill to ensure accuracy, and that we are responsible stewards of the resource. In conclusion, these simple language adjustments have the potential for substantial impact towards successfully improving the utilization of PTP in Maine where appropriate, and allowing those with serious mental illness who may need more structured plans to receive treatment in the least restrictive, appropriate setting, while also providing support to mental health providers and private entities involved in the process. Thank you for your time and attention. I'd be happy to answer any questions you may have today or make myself available for questions at the work session.
Thank you. Questions from the committee for Ms. Poulin? Representative Graham and then Zager.
Thank you, Madam Chair. So a court-ordered outpatient program for individuals is otherwise known as blue paper.
No.
This is very specific to
separate.
individuals being released. This is to ensure, well, I shouldn't say ensure, to help support individuals to adhere to their treatment plan while they're in the community.
Thank you for that.
Mhm.
Thank you, Director. What are the mechanisms in place or would be in place to make sure that the funds that are available are equitably distributed? To make sure that it's not like the first person in line gets, $3,500 and then 5 people later get zero. How do you make sure that it's fair by that or other means?
Yeah, it's a really, really important and interesting question. Thus far, the funds have been highly underutilized, so it's very difficult for us to actually gauge what the need truly is because of the cap and the information that we've received from providers who are just not interested in accessing because it doesn't meet their needs. We really don't know. What we did put in place is the process that I just outlined in about a sentence, which is that we're really asking people to not only submit an invoice for what they're requesting for funds, but also the attorney invoice so that we're able to compare what's being asked with what's being billed so that we can make adjustments as needed. When we approached the amendment to this statute, we initially were thinking that we would not put a cap at all so that we could help assess and adjust. But there has been some support for putting somewhat of a cap so that we're able to stretch the funds. I think this is, again, a little bit of a trial period and we may need to amend again. But what we do know is that there are funds available that aren't being used.
Deb, the amended language that the bill sponsor, you've seen it in its entirety? And then the reimbursement of law enforcement, legal guardians, legal counsel, or mental health care providers for the legal cost to initiate or renew a PTP up to $3,500 per initiation or renewal. You're good with that figure?
We are not opposed.
Okay. Thank you. Any other questions? Seeing none.
Thank you.
Go ahead, Ann.
Hello.
Senator, while Ms. Sedlak's signing in, would you like to introduce yourself?
Hi, good afternoon, everyone. I'm Senator Tim Nangle. I represent Senate District 26, which is Wyndham, Raymond, Casco, Fry Island, and parts of Westbrook.
Thank you. And I apologize for jumping to the front. I had to head over to HCFS. But good afternoon, Representative Meyer, members of the committee. My name is Ann Sedlak, and I'm the Director of Advocacy for the Maine Medical Association. For this testimony, which is written, it's a little bit longer than I usually give, so please read in its entirety, and I'll try to make it a little bit shorter. But I'm testifying on behalf of the Maine Osteopath Association, but also the Maine Association of Psychiatric Physicians. We are in support of this bill, and I just heard about the amendment. It sounds like it's in line with the goals of our members, which is to support the PTP program. We believe that this bill is an important step towards clarifying and encouraging practitioners to support their patient and progressive treatment programs from initiation through annual renewal. We believe the PTP program should be celebrated, and all should be encouraged to play their part in ensuring patients keep access to this vital care. I wanted to share one story from a member that provided, which is towards the end of the testimony, of consider a man in his late 30s with a schizophrenic affective disorder. When well, he is gentle and reflective and wants nothing more than to live quietly and independently. When ill, he becomes convinced that his medications are poisoning him and the world around him is dangerous. Over the years, this has led to repeated hospitalizations, police encounters, and terrifying stretches of homelessness. His family has lived in constant fear that the next call will be the worst one yet. After his most recent hospitalization, he entered the PTP program. His treatment plan was not extraordinary: regular outpatient care, medication, coordination with housing, and clear expectations for follow-up. What was different was that the system no longer looked away when he began to drift. When early signs of relapse appeared, outreach happened quickly, support was mobilized, treatment was reinforced before crisis took over. Months passed without emergency room visits. He stayed housed, his family slept at night, and when he regained stability, he said something that stayed with this member: that the program didn't feel like punishment, but like protection from the part of the illness that had been repeatedly destroying his life. Our members believe this is what PTP can do. It can help people before tragedy strikes and reduces the revolving door of emergency departments and inpatient units. It spares families from being the exhausted backstaff of a broken system, and it lowers the risk that untreated psychosis or mania will be mistaken for criminal behavior and managed by handcuffs. We urge you to support this bill and its amendment, and we appreciate Senator Moore and the department for bringing it forward. We're happy to answer any questions. I know there are a lot of people here to testify, but thank you. And the flowers are beautiful. So I just wanted to say that. So thank you.
Thank you. Questions from the committee from Ms. Sedlak? Seeing none.
Thank you.
Testimony in support.
Representative Meyer, members of the committee, thank you for the opportunity to testify in support of LD 1989. My name is Bob Staples, and I'm here to urge the committee to strengthen LD 1989 by fully aligning reimbursement policy with Maine's Progressive Treatment Program statute. Progressive treatment programs, or PTPs, are a critical tool for individuals with severe brain disorders who, because of illness, not choice, cannot consistently recognize their need for treatment. When implemented appropriately, PTPs reduce repeated crisis, prevent homelessness and incarceration, and saves lives. LD 1989 takes an important step by clarifying reimbursement for legal costs associated with PTPs. However, as currently written, reimbursement remains too narrowly framed. Under existing Maine law, PTPs may be issued or renewed by legal guardians and law enforcement officers, not just mental health care providers. Yet reimbursement practices often include these authorized actors, discouraging timely and lawful intervention. Guardians are often the last line of protection for a loved one who is deteriorating. Law enforcement officers are frequently the first to identify dangerous cycles of crisis. Medical personnel, which includes physicians and hospital clinicians, are in a position to recognize serious medical and neurological drivers of instability. If the state authorizes these individuals to initiate or renew a PTP, LD 1989 should ensure they are eligible for reimbursement as well. I urge the committee to amend LD 1989 to explicitly allow reimbursement for legal guardians, legal counsel, law enforcement officers, as well as mental health care providers, public or private, for both initiation and renewal of PTP legal costs. I also strongly support including a clear cap of $3,500 per reimbursement. This cap promotes accountability, protects taxpayer funds, and reduces the risk of excessive billing or fraud, while still allowing legitimate legal costs to be reimbursed. This is a targeted, responsible fix. It does not expand the use of PTPs or reduce due process protections. It simply aligns reimbursement policy with existing law and adds a necessary fiscal safeguard. When reimbursement is unclear or unavailable, PTPs are delayed until harm occurs. Clarifying eligibility and setting a firm cap will help ensure earlier, safer intervention and better outcomes for individuals, families, and the state of Maine. Thank you for your time and thoughtful consideration of LD 1989.
Thank you for being here today. Questions from the committee? Representatives Graham and then Daigle.
Yes, thank you, Madam Chair. Mr. Staples, can you tell me what organization you represent, please?
The Brett M. Staples Brain Disorder Awareness Coalition.
Thank you.
Go ahead.
How many people are within the PTP program in Maine? Do we have an idea?
Was it about 70? 72.
Seeing no other questions, thank you for being here.
Good afternoon, members of the Health and Human Services Committee. My name is Becky DeHady, and I would like to thank DHHS for bringing this issue forward for review, particularly Senator Marianne Moore. I have an adult child with severe mental illness. My husband and I are his guardians. One of the primary symptoms of his illness is anosognosia, or a lack of insight of his disease. This makes him reluctant to take medication as he does not recognize the need for it. In the past, while unmedicated, he traveled to foreign countries and placed himself in harm's way. He had all his belongings stolen for several times, and on another occasion was arrested for irrational behavior. He's had episodes of violence or threatened violence to himself. Our son has been most stable while on a progressive treatment plan. He was hospitalized in the summer of 2024, and we were able to obtain a PTP. Throughout 2025, he was very stable. We sought to maintain this stability by extending the PTP. The ACT team at Community Health and Counseling Service and Dorothea Dix Hospital were unable to file the extension, but as guardians, my husband and I were able to file for the extension. Due to the changes in the way the PTP is handled, we were told by Bangor District Court that we had to hire a private attorney. Through the work of the National Shattering the Silence, the organization, we were able to find a very proficient attorney. Initially, it was very difficult to find one familiar with the PTP program. Through his excellent assistance, we were able to get an extension. The longer our son remains on medication, the more hope we have that he might gain some insight to the benefits of treatment. I decided to speak today on behalf of the families that are unable to afford an attorney. I'm a registered nurse. I'm able to work an extra shift almost any week if I need money for an unexpected expense or bill. Most Maine families don't have that luxury. I would ask that you would consider the cost of hiring an attorney for the average Maine family when you consider this bill. Families need the opportunity to request PTP extensions without worry for extreme financial distress. My family and I have found the PTP an invaluable tool to assist our loved one in maintaining a stable, productive life and avoid the added expense and heartbreak of another hospitalization. I want every family that seeks to extend a PTP for their loved one to have the same opportunity I've had and not to be handcuffed by the expense. Thank you for your time.
Thank you. Mr. Haiti, questions from the committee? I'm seeing none. Testimony and support?
Hello, my name is Lucy Washburn. I'm here today to tell you my story of how it all played out, where I was the first mom to have to deal with my son soon getting out of his PTP and his provider telling me that it really should be renewed and extended. Then I find out that the AG would not support the extended PTP renewal. So this was a pure hell. So let me just read what I've written. What you have in front of you is my testimony of how it all played out with my son being on a PTP from June of 2024 to June of 2025. So he did well on his PTP. He lived in a group home in Lewiston. It wasn't the best area of Lewiston, but we made it work. It is fine because he was close to family. He worked odd jobs while he lived there. He participated in attending his nephew's baseball games. He'd give them pointers on improving their games. He laughed and played with his youngest baby nephew. He participated with family functions. He interacted. Once the guidance was withdrawn, he went downhill within 4 months. So I urge committee members to read the absolute hell my loved one and I went through just because his PTP was not renewed. Life-threatening situations can be avoided. His journey continues once he's left Maine on December 1st, and he was hospitalized in Massachusetts, refusing all meds, discharged on day 6, kept driving in his van, slept in his van, and made his way to Baltimore, Maryland, was hospitalized there in Baltimore, was there for 14 days. And he had a court hearing in the hospital, which I was able to testify. And the judge would not allow any history brought up. It had to be within 1 month's time. The judge came out and she said he was to be discharged. It was a Friday night.
Ms. Washburn, could I ask you to kindly wrap your testimony up? We've reached 10 minutes.
I want to just tell you that a PTP renewal must happen. My loved one is lucky to be alive and is not out of the woods yet. This is all unnecessary.
Thank you very much for sharing your story.
Welcome.
Do we have any questions for Ms. Washburn? I'm seeing none. Thank you for being here. Testimony and support.
Representative Meyer, other distinguished members of the Health and Human Services Committee, my name is John Nutting. I'm the Policy Director for the main chapter of the National Shattering Silence Coalition. I want to thank the department and Senator Moore for bringing this bill forward. Of course, as a state senator, I was the prime sponsor of this law back in 2003. Very pleased that it passed 117 to 31 in the House and 32 to 3 in the Senate, yet it keeps running on to these roadblocks that keep the law from being used. On line 9 of the bill, you see private equity is crossed out. I learned a month ago that private equity was a problem and had to be replaced, and this bill does that. I was part of the PTP study group done by Dr. Bader 4 years ago that recommended this very language. Senators Breen and Bennett and Claxton worked very hard to make sure it was funded, and yet the money has been sitting there, $160,000 for 3 years. Other than $800 is totally unused. In July 1st, the AG announced, surprising parents and hospitals and DHHS, that they were no longer going to represent any PTP renewal hearings. If your psychiatrist says your loved one should be renewed and you can afford an attorney, it may happen. But I know 2 families that just couldn't afford the attorney, and so their loved one has not got renewed. This bill fixes that as well. The third thing that's happened that we're still trying to get to the bottom of, but I want to bring before the committee, and I distributed this to everybody. This is just a letter from one of the providers in the community saying that they will no longer initiate a PTB renewal, and that state hospitals can initiate a PTB renewal. To my count, so far we've had over 30 hospital ZAC teams and group homes make this announcement that they won't initiate any more PTB renewals. If a hospital can't and the ACT team can't, it's a closed circle, so nobody can. Please, please, in the committee, besides passing this very important bill, try to get to the bottom of why all of a sudden, after 14 years, nobody will, or most people won't even initiate a PTP renewal anymore. What good is a fund if nobody's going to initiate the form? We're in support of the amendment. This is a PTP renewal form here. I distributed to everybody. This is the groups that can initiate a PTP renewal on the bottom. And of course, the bill as worded initially doesn't include law enforcement and guardians, and so the amendment would fix those 2 things. We've asked the AG and the department both to put out a clarification memo to all of these group homes, ACT teams, and hospitals on urging them that the law allows them to initiate a PTP. Please consider doing so in the future. We've been unsuccessful so far in the last 3 weeks to get anybody to issue a couple paragraph memo.
Thank you, Mr. Nutting.
Happy
Questions?
to answer any questions.
Questions from the committee? I'm seeing none. Thank you for being here.
I also wanted to distribute to everybody, because it's the best I've ever seen. This is about psychosis. It's written by a peer that is a schizophrenic himself. It's nationally recommended, and so I just wanted everybody to have a copy.
Good afternoon.
Welcome.
Senator Ingerson, Representative Meyer, members of the committee, thank you for the opportunity to testify today. I'm here to offer law enforcement and public safety perspective on the Progressive Treatment Program, which is a program the Maine Sheriff's Association has supported, and to speak in support of LD 1989, which should reimburse law enforcement for PTP-related transports and services with an appropriate cap for reimbursement. You will hear today from Disability Rights Maine. They will argue that PTPs are unlawful, unconstitutional, and coercive. They will say these programs violate due process and civil liberties. From where we stand in law enforcement, that argument ignores reality. When individuals with severe brain disorders lose insight into their illnesses, that often, while they often refuse treatment, not because of an informed choice, but because the illness itself prevents that insight. When treatment breaks down, the system does not become more right protective, it becomes reactive. And when it becomes reactive, law enforcement becomes the default mental health system. We respond to repeated crises calls. While we transport people in psychiatric distress, we assist with emergency hospitalizations. We sometimes we wind up arresting those individuals for behavior which is driven by untreated illness rather than criminal intent. That is not humane, and that is not what the civil rights advocacy should be producing. PTP exists to interrupt that cycle. They are less restrictive than repeated involuntary hospitalizations, far less restrictive than jail. And when treatment is consistent and enforced through the courts, we see fewer emergencies, fewer dangerous encounters, and fewer traumatic interventions when everyone involved, including law enforcement. But when that part, but here's what is often ignored. PTP rely on law enforcement. We're a big part of that wheel. When someone decompensates, refuses treatment, or needs transport for evaluation, officers are called. These calls are time sensitive, medically complex, and often involve long transports and extended supervision. None of this is routine policing. LD 1989 recognizes that reality. It does not expand PTP authority. It does not create new mandates. Under main PTP law, guardians, law enforcement, and qualified medical personnel can initiate or renew a PTP. A reimbursement cap on legal expenses is reasonable. It protects taxpayers while acknowledging that these services have real costs. Disability Rights Maine may argue eliminating or weakening PTP protects liberty, but without PTP, the result is often not freedom, but more crises, more hospitalizations, and more law enforcement encounters under worse conditions. LD 1989 supports stability, accountability, and fairness. We should recognize the role law enforcement already plays and ensures that role is sustainable. I urge the committee to be cautious of claims that PTP is unlawful and to support LD 1989 with a clear reimbursement cap, adding guardians, law enforcement, and qualified medical personnel to those who can receive reimbursement for legal costs. Thank you for your time. I apologize for going over.
Thank you, Sergeant Schofield. You too.
I had to ramp it up. My apologies.
Questions from the committee? Representative Daigle.
How many prospective PTP patients are in jails right now? Do you have any idea?
I couldn't give you a number, but I would bet you a cup of coffee there certainly are a good handful of them, just because they're not. We're driving a square peg into a round hole. We're not fitting the appropriate person jail's not always appropriate. Sometimes it is for other people, but when people are in these psychiatric breakdowns, you're not fixing the problem. It's like putting duct tape on the hole in your boat when you're out in the ocean. It just gets you back to shore. You got to fix the problem beyond that before you go out fishing again next week.
Is that handful in your county, or does that cover the state?
I can speak for my county and anecdotally for my colleagues that I rub elbows with around the state. But that's, I'm sure every single law enforcement officer in the state can give you a story of someone that comes to mind immediately that is incarcerated, when perhaps a better fit would be to get them the appropriate help with a structured program. Thank you.
Testimony in support of 1989? Anyone on Zoom? Yes. Hi.
Good afternoon. Thank you. Good afternoon, Chair Meyer and honorable members of the Health and Human Services Committee. My name is Megan Maloney. I'm the District Attorney for Kennebec and Somerset County, and I'm here to testify in support of LD 1989. This bill is critical because it expands access to funding for mental health care providers who deliver progressive treatment programs. These programs are proven to help individuals with severe mental illness maintain stability, avoid hospitalization, avoid prison, and live healthier lives in our communities. As a district attorney, I do see firsthand the intersection of untreated mental illness and the criminal justice system. Too often, individuals with severe mental health conditions cycle through jails and the courts, not because they're dangerous criminals, but because they lack consistent access to treatment. This is costly, ineffective, and inhumane. The Progressive Treatment Program offers a proven, structured alternative, court-approved treatment plans that keep people stable in the community rather than incarcerated. However, the current funding limitations make it difficult for medical providers to initiate or renew these programs, leaving gaps that put both the individual and the public at risk. LD 1989 addresses this gap by ensuring that providers can be reimbursed for both initiating and renewing progressive treatment programs. This change will improve continuity of care, reduce costly emergency and criminal interventions, and strengthen Maine's mental health system. It's not only compassionate, it's fiscally responsible. I urge you to support LD 1989, and with the few minutes I have, I will answer the good representative's question. I do know of cases on my caseload where the person went off of a PTT, and one in particular that is particularly devastating to me because it's a case I'm handling personally, and I won't say the name, but the person is facing decades in prison for the crime that was committed when the PTP lapsed. So that means that there was tremendous harm caused, and not only to the people that were harmed, but also to him, because that didn't need to happen. So I'd be happy to answer any questions.
Yes, Representative.
How long is a PTP approved for initially?
A year is my understanding, although they are the experts. Yes, 1 year, yes.
And how long is a renewal?
I believe it's also 1 year.
Thank you.
Yes, Representative Lemlin.
Thank you. Do these people not qualify for appointed attorneys instead of needing to get their own attorney, a court-appointed attorney?
If someone is charged with a crime, they always qualify for a court-appointed attorney. What we're hoping with the passage of this bill is that people can have help in getting their PTP without committing a crime, right? We don't want people to commit crimes. We want people to get the mental health care they need and not have criminal activity. And if there's no criminal activity currently, I don't believe there is a way to get a free attorney. Again, I do know that they have far more knowledge because the PTP is not a process I use myself. I see the impact when someone goes off of their program. I don't bring PTP, I don't initiate PTPs myself. Although I know that could be like, that's a civil remedy that I could dismiss a criminal case for a civil remedy. That's an option, but it's not a process that I'm directly connected with.
That was my next question. I'm just curious why they need an attorney to even do this process. I mean, why can't a psychiatrist start the process instead of, why do they need an attorney?
Well, my understanding is that that is what this bill would allow for, is that medical providers aren't willing to be involved in this process because they're not going to be compensated. And the money is appropriated already. So the money's available. But right now, this loophole is preventing them from getting paid. So we just want to close that loophole and let them get paid. Yeah.
Thank you.
Thank you.
Go ahead, Representative Zager.
Thank you, Madam Chair. Dean Maloney, great to see you again.
Great to see you.
Thank you for your testimony and your expertise, specifically with regard to the intersection of mental illness and criminal justice system, that unfortunate intersection. You've spoken about the effectiveness, clinical effectiveness, the compassion, fiscal responsibility. Can you say a word about due process, equal protections, other constitutional protections, and how that balances with the other clear benefits of the PTP?
Thank you for that question. It's an excellent question. What is very important about this process is that it's all overseen by the court system. So nobody is going to be placed on a PTP without a judge giving approval. And I do think that is a very important protection for people's rights. It's not something that should be done without a lot of oversight. And so this process, not only does it bring the medical professionals into the process, which is what we need, but as always, it's part of the court process, the civil process, not on my criminal caseload. Yeah.
We follow.
Yes.
So if I understand you correctly, we have these funds allocated. There's the structure is in place, not perfect. This would improve the structure.
Yes.
The legal grounding of the program is not under any serious assault.
Correct.
Okay.
Yes, correct.
I mean, outside of what we're discussing here, I mean, like in the legal world, is it true that it's not under serious assault?
I don't know of any legal assault on this program. Again, it's not a program that I use often, so I do look to the others in the room to see if they know of anything. I've only had the PTP talked about when someone goes off of a PTP and then commits a crime, and that's how I learn about the individual. And lately, because I do oversee our mental health docket, I have been asked by defense attorneys if I would agree to dismiss the criminal case if the individual went on to a PTP program. And that is something I'm always happy to agree to. I don't do the work of the PTP. That's something the defense attorney does. But I'm more than happy to agree to that. What I want is for the individual to be safe and our public to be safe. And the PTP makes that happen.
Thank you. Appreciate it.
Thank you for being here.
Thank you.
Testimony in the room in support? Welcome.
Thank you. Good afternoon, Representative Meyer, and honorable members on the Committee on Health and Human Services. My name is Adam Bloom-Pykopoulos. I'm the Executive Director at the Alliance for Addiction and Mental Health Services. We are the statewide association representing community behavioral health providers in Maine. On behalf of the Alliance, I'm here today to speak in support of this legislation. This legislation makes important changes to the PTP program fund that will help make the fund more accessible to community behavioral health providers as the fund was intended for. As of today, I'm not aware of the fund having been used, primarily due to the cap of $800, an amount far too low to enable a community provider to reasonably process the administrative and legal work required. The changes in this bill to remove this cap and clarify the funding can be used for renewals as well as initiations is welcomed by community providers. That said, more needs to be done to ensure that this complex system is operating smoothly and is strengthened in a way that meets the needs of individuals, families, and providers. For this reason, we again respectfully ask this committee consider establishing a new work group to assess current challenges and identify actionable solutions within the PTP system. Since the previous work group that convened in 2021, much has changed in the landscape of PTP. Most notably, the Attorney General's office announced that they would no longer be a party on PTP extensions or modifications, creating a significant system-wide gap. Aside from the financial burden placed on community providers, this vacuum has resulted in potential conflicts of interest among provider agencies and strained administrative capacity with little department involvement to renew or initiate PTPs. During today's hearing, you've heard and will likely hear additional concerns surrounding PTP as well as other possible solutions. We strongly believe, as we did last year with LD 1799 alongside Representative DeBrito, that a renewed collaborative work group with representation of all involved perspectives would yield positive results across the system. We are grateful to the department and to Senator Moore for bringing this legislation forward, and we strongly urge the committee to support LD 1989 as a first step towards improving this system and making the fund more accessible for providers. I will say, it's not in my testimony, but on the proposed cap of 3,500, I might be happy to bring some additional information from providers ahead of the work session on what estimated costs might look like. Again, it's hard to estimate as it hasn't been used so far because $800 was not enough, but I can work on that to see if that cap would be something that would allow the fund to still be used as it was intended. Happy to answer any additional questions today from the committee. And I did also want to acknowledge that Representative Javener's presence will be sorely missed from this committee. Thank you all.
Thank you. Questions for Adam?
Thank you, Madam Chair. Thank you, Adam. Appreciate your testimony as usual. So are you suggesting that the work group, we amend this bill so this work group is part of that, or are we going to just follow, we were able to pass Representative Brito's bill? Can you tell me a little more about how you envision this happening?
If the legislature were to identify funding, or this committee would think that would be possible, I think adding that as a component to this would be welcome, at least from the provider perspective, to address some of these issues. Acknowledging that funding for work groups isn't always the easiest thing, but we did want to acknowledge that. But the standalone elimination of the cap, we do agree with. Yeah, thank you.
Yes, Representative Daigle.
You talked about the Attorney General no longer a party. How long has that been going on?
I believe this was last year. I might stand corrected, but I know at least by the time that we had done our bill, Representative Brito, this was a factor of this.
In August.
Seeing no other questions, thanks for being here. Anyone else in the room with testimony and support? Anyone on Zoom? No. Testimony in opposition? Anyone on Zoom? Testimony neither for nor against, but with additional information for the committee to consider. Seeing none. Requests from the committee for our analysts for additional information. Yes.
Thank you, Madam Chair. Just the cross-reference definition of mental health providers must be somewhere in statute because that's not listed in this bill.
Okay, I will close the public hearing on LD 1989. And open the public hearing on LD 2051 and welcome the bill's sponsor, Representative Pluker.
Good afternoon. Thank you so much for having me in.
Welcome.
Representative Meyer. I'm Bill Pluker. I represent the communities of Warren, Hope, and Union, House District 44. And I present to you today LD 2051 to help clarify eligibility for Maine's state-funded food assistance program. For nearly 30 years, Maine has provided state-funded SNAP to lawfully present immigrants who may have been excluded from federal benefits. This program reflects our values and pragmatic recognition that hunger harms all Mainers. Reflect recent federal changes under H.R. 1 threaten to leave refugees, domestic violence survivors, and trafficking victims without food assistance despite their legal presence and humanitarian protections. LD 2051 clarifies the definition of non-citizen legally admitted to the United States to ensure these vulnerable populations remain eligible for state benefits as originally intended. I do not intend an expansion of current benefits with this bill. It is intended to be a technical correction to preserve existing coverage for people who should already qualify under Maine law. The individuals affected have been heavily vetted by our federal government. They include refugees who have waited years for resettlement approval, survivors fleeing violence under VAWA protections, and human trafficking survivors. Many are elderly, disabled, or awaiting work authorization through no fault of their own. I want to clarify that we've learned that the department interpreted part of the language as a program expansion, which was not the intent of the bill. The bill aims to preserve eligibility for current recipients and those previously federally eligible before H.R. 1's passage. And I'm committed to working with the department or any necessary language on any necessary language refinement to make that intent clear in the bill. It's important that the Maine legislature reaffirm our commitment to ending hunger. SNAP helps families put down roots, find employment, and contribute to Maine's communities. Everyone deserves to eat. And I urge your support for LD 2051. Thank you very much.
Thank you, Representative Pluker. Do I have questions from the committee for the bill's sponsor? I'm seeing none.
All right, thank you.
So we'll start with testimony in support of LD 2051. Welcome.
Thank you. Good afternoon, Representative Meyer and members of the Joint Standing Committee on Health and Human Services. My name is Alex Carter. I use she, her pronouns, and I'm a senior policy advocate at Maine Equal Justice. As an organization that serves immigrants and represents low-income people who struggle with food insecurity, I'm testifying in support of LD 2051. I've also been thinking about all of you and Representative Jabner's family this week. Before we delve into federal law and Maine's legislative history, I want to first ground us in what and who we're discussing today. We're here today to talk about low-income, lawfully present members of Maine's immigrant communities and their ability to continue to receive food assistance. In the simplest terms, we're talking about hunger and who is considered deserving in this country of having enough to eat. In 1997, in response to PERORA, or welfare reform of the 1990s, the Maine legislature established its state-funded program for non-citizens who would otherwise qualify for SNAP, but for federal exclusions. The legislature has since reaffirmed and refined that statute multiple times with bipartisan support, adding the current hardship exceptions that we can discuss if you have questions. Just like the federal program, state SNAP benefits help people with low income purchase groceries, and beneficiaries must comply with all other program rules. We're here today because H.R. 1, the sweeping budget reconciliation bill passed in July, made the largest cuts to the SNAP program since its inception and further restricted immigrants' ability to receive essential benefits, including SNAP. Under H.R. 1, heavily vetted refugees, asylees, certain survivors of trafficking and abuse, and other previously qualified humanitarian immigrants are no longer eligible for federal SNAP benefits. This is both cruel and short-sighted. Under our reading of the law, humanitarian immigrants facing new restrictions should already be eligible for state-funded SNAP if they meet the other program qualifications. LD 2051 simply clarifies the definition of non-citizen legally admitted to the United States to ensure that those who should currently receive SNAP benefits in Maine can continue to receive them if they experience a hardship. The intent is not to expand eligibility, but rather to preserve it for as many people as possible under existing law and help make benefit determinations more efficient. Should the department interpret that impact of this legislation differently, we'd also be happy to work with them and the bill sponsor to achieve that shared aim. For nearly 30 years, the legislature's intent has remained clear and consistent. LD 2051 reaffirms and clarifies that intent in response to new federal law. Maine can't fill all the gaps left by H.R. 1, but this is one targeted way we can mitigate harm and prioritize protections for those most impacted. I encourage you to support LD 2051. I'd be happy to answer any more detailed questions, and I'll also be available for the work session. Thank you.
Thank you. Questions for Ms. Carter? I'm seeing none. Thank you for being here. Testimony in support.
Stealing out of my bench.
Sure.
You go.
Sorry, getting ahead of myself. Thank you. Good afternoon. Representative Meyer, members of the Joint Standing Committee on Health and Human Services. My name is Sam Zuckerman. I am the policy coordinator of the Permanent Commission on the Status of Racial, Indigenous, and Tribal Populations. I'm here today to testify in support of LD 2051 and act to ensure access to the Supplemental Nutrition Assistance Program in Maine. The Permanent Commission's Policy Committee broadly supports legislation aimed at addressing food insecurity in Maine. Access to healthy, nutritious, and culturally appropriate food is at the center of all human well-being, and all food insecurity is cause for concern. But patterns of food insecurity fall unevenly across our communities, with notable disparities among racial groups. This has many causes, including a lack of accessible food retailers, lack of access to land for farming and cultivation, and wealth and income inequality. These challenges are compounded for racial minorities who are also new Mainers or those seeking asylum who face additional challenges to accessing state benefits and securing reliable forms of income. This bill would ensure that new Mainers that have been eligible to receive SNAP benefits in the past do not have to worry about food security as they navigate our complex immigration system. Food insecurity impacts both longtime and new Mainers, with 1 in 8 people and 1 in 5 children facing hunger in Maine in 2022. But new Mainers are especially vulnerable to food insecurity. Maine Health reported in 2025 that based on intake screenings, 7% of English-speaking patients had faced food insecurity, while 20% of non-English speaking patients had. And a study of food insecurity disparities among immigrants found that non-citizens are 1.28 times more likely to face food insecurity than citizens born in the United States. This disparity between immigrants and citizens all but disappeared when immigrants had access to SNAP benefits. This tells us that SNAP benefits are working to keep people fed and to prevent further downstream health challenges that result from lack of access to healthy foods. When everyone is fed, we all benefit because people are able to bring their full attention and energy to their jobs, their families, and their communities. Thank you for your time and attention. I urge you to vote in support of this bill, and I'd be happy to answer any questions.
Thank you for being here. Questions from the committee? Seeing none.
Thank you.
This is such a nice audience. You're so kind to one another. It's lovely to see.
Hi.
Welcome.
Good afternoon, Representative Meyer and esteemed members of the Joint Standing Committee on Health and Human Services. I'm Anna Corson, Deputy Director with Full Plates, a statewide nonprofit working to address childhood food insecurity in Maine by maximizing access to federally funded USDA nutrition programs like SNAP and school meals. We are a founding member of the Hunger Free Maine Coalition, who advocates to advance the priorities of Maine's roadmap to end hunger. I also serve as the co-chair of the Ending Hunger in Maine Advisory Committee, and Full Plates is a contracted SNAP outreach organization with the Department of Health and Human Services. I'm here today in support of LD 2051, an act to ensure access to the Supplemental Nutrition Program. The passage of HR 1 last summer has made historic cuts to the nation's most successful food assistance program, including eliminating eligibility for lawfully present non-citizens. Based on DHHS data, this could terminate federal benefits for roughly 2,000 legally present immigrants residing in Maine. This bill will clarify Maine's existing state-funded SNAP program and send a clear message to DHHS and immigrants in Maine that our state SNAP program will continue to support them. This federal change is a stark departure from America's long-standing bipartisan commitment to people fleeing violence and persecution. Maine, and indeed this committee, unanimously enacted state SNAP for these categories of immigrant statuses in 1997 after similar federal cuts to public benefits. The legislature affirmed that dignity and respect for all residents in Maine are values and has since enshrined the right to food in our Constitution and established a commitment to ending hunger in Maine by 2030. Maine is leading the nation in feeding kids at school due to our School Meals for All policy, and we applaud the continued investment by the legislature and administration for that investment. However, for too many kids, school breakfast and lunch are the only meals they can count on. To ensure food security for all kids, all day, every day, Maine must stay committed to SNAP and to eliminating childhood hunger. In a time marked by fear, federal confusion, and increased challenges for DHHS in administering new rules and attacks on immigrant communities in rhetoric and policy, clarifying and protecting our state SNAP is a small but significant step to protect some of our state's most vulnerable children who experience hunger at the highest rates in a state with the highest childhood food insecurity in New England. Please support LD 2051. Thank you for your time, and I'm so sorry for the loss of your colleague.
Thank you.
Thank you.
Questions? Yes, Representative Graham.
Thank you, Madam Chair. Thank you, Anna. Nice to see you. Could you, are you getting reports in already from families who are struggling because they've lost their SNAP benefits and any case scenarios that you have seen?
We've been hearing from food pantries who tend to see higher numbers of immigrant families coming to their food pantries, that there has been a decline in those families because they don't feel safe to leave their homes. And so SNAP, access to SNAP is even more important for those households.
Seeing no other questions, thank you for being
Thank you
here.
very much.
Thank you. Good afternoon, Representative Meyer and the members of the Joint Standing Committee on Health and Human Services. My name is Terrence Miller, and I'm the Advocacy Director of Preble Street. Preble Street is a proud member of the Hunger Free Maine Coalition. Mission of Preble Street is to provide accessible, barrier-free services to empower people experiencing problems with homelessness, housing, hunger, and poverty, and to advocate for solutions to these problems. Preble Street operates 20 programs throughout the state of Maine, and our staff works daily alongside hundreds of individuals and families who struggle with food insecurity. I'm here today on behalf of Preble Street to express our strong support for LD 2051, which clarifies the SNAP rules for non-citizens who meet the hardship exception, so they remain eligible for state-funded SNAP benefits. Many of my colleagues have already given you the context of this, but I want to address Representative Graham's question and lift up the human face of this issue to you today. Preble Street's Anti-Trafficking Services Program has worked with numerous survivors of trafficking and domestic violence who needed food access provided through Maine state-funded SNAP. One story out of the hundreds illustrates how the state-funded SNAP benefit was a critical lifesaver. Maria, a survivor of trafficking from Central America, and her child survived due to this benefit. After Maria's child was born, she could not keep her employment due to the lack of affordable childcare. Although Maria is now employed, she can only work a limited number of hours because she still does not have access to childcare, which significantly impedes her ability to increase her income. Recently, Maria's SNAP's benefits were cut, further destabilizing the family. Without SNAP and with limited work hours, Maria and her young children must now spend much of their limited time searching for food resources, such as food pantries, instead of focusing on employment or long-term stability. This experience is not unique to Maria. It is prevalent among survivors of trafficking, survivors of domestic violence, and legally present asylum seekers and refugees, all of whom face compounding barriers when critical supports like childcare and nutritional assistance are inaccessible. In closing, LD 2051 provides clarity, allowing legal present non-citizens who are survivors of domestic violence or trafficking to receive food access through state-funded SNAP support. I urge you to vote ought to pass on LD 2051. Thank you.
Thank you for being here today. Yes, Representative.
Thank you again, Madam Chair. I appreciate it. As you can tell, this is kind of close to my heart. And then thank you for bringing that story, Terrence. My question for you is, are you seeing, is Preble Street seeing an uptick in food pantry, attendance, not just from individuals who are struggling, who are lawfully present new Mainers, but in general, what are you seeing in the big picture?
Yeah, so the big picture, and thank you, Representative Graham, for that question. As you know, of the Food Security Hub in South Portland,
which prepares meals through its commercial kitchen, has had to increase its prepared meals from 2,000 a day to 2,600 a day to meet the need. And our need of sending out food boxes has increased to 1,000 food boxes per week. So we have distributed more food boxes in November and December than any previous time. So it's just been a tremendous uptick and fear in the community. And so that combination of fear with this tremendous need, with this, just needs the clarification around this at this time. You're welcome. Thank you for the question.
Representative?
Providing food is a wonderful thing. And unfortunately, the fiscal climate we're in, where budget is tight, do we have any idea of what kind of an increase will happen with the state funding for this?
Yeah, I believe Representative Pluker answered that, intending that this is not to increase, it's to define what non-citizen legally in the country means. And so I believe that's going to be addressed during the work session and as the bill progresses.
Yeah, again, because of the federal cutback, we either cut back or resupplement, which is what my question was all about. So if we could have some idea of what it would be, it makes our work a lot easier.
Thank you for the question.
Seeing no one
Great.
others?
Thanks so much. Have a good afternoon.
Good afternoon. Representative Myers and member of the Joint Standing Committee on Health and Human Services. My name is Dr. Tori Rogers, and I'm here on behalf of the Maine Academy of Pediatrics in support of LD 2051, an act to ensure access to supplemental nutrition assistance program in Maine. As you're all well aware, nutrition is a cornerstone for health for children and adults. When folks don't know where their next meal is coming from, this adds to the stress they may already have of worrying about paying about medical bills and heating bills and housing bills, et cetera. Knowing where they're going to get access to nutritious food using their SNAP benefits can really help alleviate many of these worries. And it helps us set up children and adults for improved health. You see, to me, food is really about health. Food is a type of medicine. There's actually a program called Food is Medicine. As you all know, as has already been mentioned, LD 2051 does not expand SNAP. It just puts access back to where it belongs before HR 1 was enacted. Denying access to SNAP benefits to individuals who are here in our state legally is callous, wrong, and just short-sighted. As a pediatrician, I've seen firsthand what happens to children who can't get the nutrition they need to grow, develop, and thrive. Nutritious foods help keep skin, teeth, eyes healthy, supports brain development, boosts immunity, which we all need right now, helps with digestion, strengthens bones, supports muscles, and helps achieve and maintain healthy weight. To not provide this to children who are most in need of it is unacceptable. Let's keep these benefits where they belong in the mouths of hungry kids and their families. Thank you for the service to the state, and thank you for your time today.
And thank you, Dr. Rogers. Questions from the committee? Did you have your hand up? Okay. Thanks for being here. Anyone else in the room with testimony and support? Can you bring Miss? She didn't come on? You sent her the link. Okay. Well, we'll give her a second to check her email. If you're listening, Amy, Sophie Dubé sent you the link to come on Zoom and provide testimony. We're going to move on to testimony in opposition in the room. Anybody? How about testimony neither for nor against, but with additional information for us to consider? So Amy, it's you. If you check your email, You've got a link and we're happy to hear your testimony. Okay. And is James Mile? No one is on. Okay.
She's on.
Okay. Hey there, we've been looking for you.
Sorry.
Welcome. You can get started.
Thank you.
We're running a
Thank you
3-minute clock.
Thank you so much, Chairwoman. My name is Amy Sacy. I am the Director of Government Affairs for Good Shepherd Food Bank. You have my testimony. I submitted it via the online website. I did want to add to the conversation that Good Shepherd Food Bank supports this bill. It did interpret it and do interpret it as a clarification, not an expansion. And I real quick chatted with my colleague in community partnerships. She said that we have absolutely seen increases in food pantry attendance. We are seeing in general, we saw that in particular in the fall when SNAP was so unknown, we saw month after month increases, and compounded with the unknown of LIHEAP. So yes, absolutely, food pantries across the state are seeing increases. We are also seeing an increase in BIPOC neighbors' needs, but they are changing because they're coming less frequently. And anecdotally, we understand this to be fear around accessing services. November was the busiest month for food orders. That's the orders that Food Pantry put into Good Shepherd Food Bank for our food inventory. November was the busiest, the highest amount of food orders that we've ever had in the history of our organization. So thank you for your thank you for your consideration. Thank you for your patience as I navigated Zoom, and I'm happy to take any additional questions now or for the work session.
Thank you, Amy. Questions from the committee? I'm seeing none. Good to see you.
Thank you. You too.
That's it. Okay. Requests for additional information from the committee for the work session. Representative.
Again, because of the drop in the federal funding, what impact will that have in Maine? We have to be able to answer that question, whether we like it or not. So if any information is available, it'll be important. I have to go home and defend one way or the other, and I can't do it without information. So
I fully understand what you're asking for. I personally, I think defending hungry children and providing them with food is probably enough information for my constituents. Any other business on our agenda? Okay, with that, I would entertain a motion to adjourn.